Common types of headaches and how to treat them. Common types of headaches and how to treat them. Most of us are familiar with some form of uncomfortable and distracting headaches once in a while. And with many types of headaches existing, the cause, duration, and intensity of this pain can vary according to its type. If your headache is less severe, then you can easily learn how to identify the type you may be experiencing, and what you can do to ease your symptoms. Discover common types of headaches and how to treat them. What does a headache feel like? There are different levels of headaches, but in general people experience throbbing, squeezing, or constant or intermittent pain in the back of the head, upper neck, or behind the eyes. Some even feel tightness or pressure at the temples. An unpleasant sensation. Some headaches are really painful. They can feel like a poke in the eye, a stabbing in the brain, or a band of pressure around the head. Severe headaches can even cause nausea and vomiting. Primary headaches. Primary headaches occur when the pain in the head is the condition. This means that the headache isn't being triggered by something that your body is dealing with, like illness or allergies. Secondary headaches. Secondary headaches are a symptom of something else that is going on. If the trigger of the secondary headache is ongoing, your headaches can become chronic. Treating the primary cause tends to bring headache relief. Common types of headaches. Many headaches have similar sensation distributions. The next, you'll see the most common headaches and how to ease them. Allergy or sinus headache. Headaches sometimes happen as a result of an allergic reaction. The pain from these headaches is often focused on your sinus area and in the front of your head. Allergy or sinus headache. Sinus headaches are treated by thinning out the mucus that builds up and causes sinus pressure. Usually nasal steroid sprays or over-the-counter, OTC, decongestants help ease this. Caffeine headache. Caffeine affects blood flow to your brain, and having too much can give you a headache. When you're used to exposing your brain to a certain amount of caffeine, a stimulant, you might even get a headache if you don't get caffeine. Caffeine headache. Keeping your caffeine intake at a steady, reasonable level can prevent headaches from happening. It will also help if quitting it entirely. Tension headache. Tension headaches are often triggered by stress. You might feel a dull, aching sensation all over your head that isn't throbbing. Sensitivity around your neck, forehead, scalp, or shoulder muscles might also occur. Tension headache. An OTC pain reliever can help with your occasional headache symptoms. But when a tension headache becomes chronic, then you must take action to address the underlying headache trigger. Cluster headache. Cluster headaches are characterized by severe burning and piercing pain, around or behind one eye or on one side of the face at a time. These headaches occur in a series, and can last from 15 minutes to 3 hours. Cluster headache. Cluster headaches affect men more often than women. Doctors may recommend oxygen therapy or local anesthetic before developing a prevention plan. Hormone headache. Women commonly experience headaches that are linked to hormonal fluctuations. Menstruation, birth control pills, and pregnancy all affect estrogen levels, which can cause a headache. Hormone headache. OTC pain relievers or prescription medications can work to relieve pain. Headaches associated specifically with the menstrual cycle are known as menstrual migraines. Doing yoga, relaxation techniques, and even acupuncture can help relieve the headache. Hypertension headache. High blood pressure can cause a hypertension headache. This kind of headache signals an emergency, and occurs when your blood pressure becomes dangerously high. Hypertension headache. These types of headaches typically go away soon after blood pressure is under better control. They shouldn't reoccur if your blood pressure continues to be managed. Ice pick headache. Ice pick headaches are characterized by short, intense stabbing pains lasting only a few seconds. These headaches can occur a few times per day, and usually move around to different parts of your head. Ice pick headache. Ice pick headaches can be difficult to treat because they last for such a short duration. You might decide to take preventive measures to reduce the frequency or intensity, such as taking melatonin, which can also help with sleep. Exertion headache. Exertion headaches happen quickly after periods of intense physical activity. Weightlifting, running, and sexual intercourse are all common triggers. That's because these activities cause increased blood flow to the skull. Exertion headache. This type of headache usually resolves within a few minutes or a couple of hours. However, OTC pain relievers, such as aspirin or ibuprofen, typically ease symptoms. Migraine. Migraines are a type of headache, often differentiated because of the intensity of the pain and the overall effect they have on the body. Migraine. For some people, migraine symptoms include auras, symptoms that occur before the pain hits. The auras can be visual, seeing lines or spots, or they can cause motor or verbal disturbance. Migraine. If OTC pain relievers don't reduce migraine pain, a doctor might prescribe triptans, which are drugs that decrease inflammation and change the flow of blood within your brain. possible medical emergency. The symptoms of a stroke can also mimic a migraine headache, so if the symptoms are new for you, seek medical attention immediately. Can you prevent headaches? Methods will differ by headache type, but many can be managed with preventive measures. Headache prevention could mean reduced headache frequency or intensity, or preventing them altogether. Your lifestyle plays a role. In general, many headaches can be prevented or improved with lifestyle changes such as getting enough regular sleep, staying hydrated, getting in regular exercise, and enjoying a balanced meal. When to see a doctor? In most cases, a headache will go away within 48 hours. If it lasts longer or if the intensity increases, seek a doctor for help. You might be suffering from a chronic headache, or it might be a symptom of more serious health conditions. Diagnosing headaches. Because there are many types of headaches, there are many methods that might be used to diagnose the type you have. Before your medical appointment, document the duration, intensity, location, and possible triggers. Please subscribe, like and share, comment below in comment section. Thank you for watching. Thank you for watching.